and myself, Councilmember Tui. Tonight, we have one main issue on our agenda, which is homelessness response update from staff. So we'll dive right into that, and I believe Julie and Ben are here to present. Thank you and welcome.
Thank you, Councilmember Tui. Good afternoon. I'm very happy to be here. You might recall several months ago, we were here and we shared with you our opioid response plan. It gave us some guidance, gave you some information. It gave the community clarity of what we were doing or where we're headed. It sparked that idea of this is something similar that we want to do with homeless response. And we hope to come back in the future and bring our care team to you as well to make sure that you have an update on that program. In addition, the community development team is working on a number of data sets so that you'll have ready access data around all of the different work that we do within our department. We've been around since 2019, but we've never really formalized kind of the open data portal and how to use the dashboards and the great resources we have within our own IT department. So that's kind of been a fun opportunity. We used our summer interns this year, and they were spectacular in really diving into the different data sets that the community might want to have available to them. And then they even created the Excel spreadsheets that then can go into the data portals that the IT department will help us to orchestrate. So that's the future work, some of the future work, just to kind of help everybody understand what's going on or try to help better tell the story of the work that we're doing. And certainly the work that we're doing regarding the homeless population, oftentimes, you know, it's not just that easy. A homeless population isn't just people who are on the streets that we see that are visible to, you know, or concerning, maybe unwell. Some of those people are housed. Some of the people that are unhoused are employed or parents, you know, so it's a very complicated and nuanced system. So everything that we're sharing with you today is kind of broad with some details, but it really is the best part of our work is that we've been able to continue to grow and be amenable to the population. And certainly by adding alternative response, adding medication on the streets with our street medicine program is really also helping this population as well as the population who are unwell, who are housed. So Ben Breeden is here. He is our homeless response coordinator. He's been doing this work since 2021. You may remember 2021 was a time when our downtown core was struggling with a lot of individuals that were living unhoused. It was after COVID, so many things it was during COVID and so many things had shut down. So Ben came on board to really help us to continue to have our balanced approach where we ensure that we have services and resources, but also that we address the impacts that businesses and residents are experiencing related to safety and all the other things that might go along with some of that negativity. So I'm going to pass it on to him. He'll share our kind of continued balanced approach, and we'll be here to answer questions.
Great. Thank you so much for allowing me to be here. Did you all get the printouts that I provided already? Great. So wonderful. Thanks so much. It's a real privilege to be here sharing with you. I'm excited to talk about the good work. I feel very grateful to be part of the Community Development Department. This evening, I'm going to share some of the areas of focus that community development is working on regarding homelessness. And I really hope that you'll hear that we are emphasizing safety and security and also services, resources, support. I believe that we're developing a balanced approach that has compassion and accountability, and that really can reduce homelessness and improve the quality of life for all of our residents. So I'm going to share 5 areas of focus that I've been working on: services and support, housing and shelter, safety, internal collaboration, and engagement and outreach. So I've provided the slides for you, but also the one pager here. This is available on our community development webpage. That'll kind of be the roadmap for what I'm sharing about this evening. Feel free to interrupt and ask any questions. Otherwise, I'll just kind of run through this and we could do questions at the end as well. So the first focus that I'd like to share about is services and support. One thing that I believe is really important in having a robust strategy to addressing homelessness is developing strong partnerships with nonprofit organizations, with faith communities, and other individuals and agencies who are invested in our community. So I believe that we do what we can and should do, and we support those nonprofits, faith communities, agencies in doing what they can and should do. So groups like Emote, which came out of the mayor's drug task force as a recommendation, Courage to Change, Everett Faith in Action, the Hot Meals Coalition, just to name a handful, they do incredible work in our city, and they provide transportation to and from treatment centers. They have peer support, health management, other basic needs that are so needed in Everett. And our partnership with agencies like this offers as often as possible fiscal support, but really also work to encourage best practices with their programs. I do want to highlight a few of these. One is the Hot Meal Coalition, and that's the graph you see on the slide, this first slide. The city was able to provide, even with an austere human needs grant this last year, was able to provide an allocation. I know that was supplemented by some of the council allocations to the Hot Meal Coalition, and they do remarkable work. There's 12 hot meals, free hot meals throughout our city. Every day of the week, there's a free meal that is available. You can see on the graph, the average for the last year is just under 5,000 meals every month that's provided by the Hot Meals Coalition. And that's to individuals, to families, to anybody who's facing food insecurity. In fact, anybody at all who's in Everett can come and enjoy the meals that they provide. A lot of the work with supporting these, I meet with them every month. We talk about the challenges they're facing. We brainstorm, we workshop different things. We work on really being efficient with the resources, with the food that's available with the funding. We talk about how to mitigate some of the impacts to make sure that this isn't overly and unnecessarily challenging and burdensome for the community around them. Another example of the city's service and support is the care team. Julie mentioned them, as well as the community outreach and prevention social workers in the city library. And I can't speak highly enough of these workers. What they do is amazing. We should be singing it from the rooftops, in my opinion. But I know that it would be great for Kelly to come and talk more in detail about that. I do just want to give a couple plugs about what they do. Just in the first half of this year, the care team responded either with emergency services and also independently deploying to over 1,800 crises in our city. So that's just remarkable, the work that they do. The next focus that I'd like to talk about is housing and shelter, which is probably the most visible area of work when it comes to homelessness. Probably the most visible flat spot, the growth area that needs to be addressed, not just in Everett, across the country, I would say. We just need more beds. We need more resources in Everett and across our country, as I said. If you Google what is the number of shelter beds in Snohomish County right now, the answer will pop up, 840 beds. And that's actually 683 of those that are available year round. The other 157 are seasonal beds. 840. Every year, the county holds as required by HUD, the point in time count, the PIC count, where one day a year, for some reason, we pick sometime in January, and we canvass as much of the county as we can, and we identify as many unsheltered individuals. This last year, the PIC count identified 1,140 people. So we've got 683 beds, 1,140 individuals that need better housing. So you could see that there's a challenge that we're facing. But I share with you that Everett is doing pretty incredible work. The numbers on the left side of the screen are the housing and shelter developments in the last 7 years. So just in the last 7 years, there's been 335 new units. That's shelter, that's permanent supportive housing. And since I've started with the city, one of my primary focuses has been project managing, working with agencies on some significant shelter projects that are expanding our capacity. So I've been working with Everett Gospel Mission, with Interfaith Family Shelters, with Volunteers of America, with the Salvation Army. Salvation Army is the managing agency of the New Start shelter that the county is funding on Everett Mallway. These shelter programs will add around 200 beds.
Is, Ben, is the New Start, is that the Days Inn Hotel? Okay, I just want to clarify. I didn't know it had a
Yes.
name. Okay, thank
Yes,
you.
it is. And
Sorry.
oh,
So well done on the numbers, the difference and the amount of increase from 2018 to 2025. I know that's a lot of work going into that, a lot of planning. So I just wanted to say thank you for that. And then a little bit more of the nuance of the types of housing and shelter
Sure.
for families, people with pets, you know,
Sure.
single men, like what?
sure. I would say the shelter models are primarily targeting single men. That's also the largest demographic of unsheltered individuals. But we have worked, you can see on this list, some that are really intending to target demographics that are underserved. So for example, the second line, Interfaith's Cars to Housing program, this is really a beautiful picture, actually. I could take a couple minutes and share with you about it. We had a forum, Everett Faith in Action hosted a forum, and there was a woman just telling her story. She ended up unsheltered, living in her car, and she just needed a place for her 2-year-old to brush her teeth. And from that, Interfaith Family Shelter partnered with Cascade View Presbyterian. They opened up space in their parking lot, the back part of their church, and there's parking spaces that Interfaith has some management with, some resources there. And that's a shelter that's intended for families. It's also intended to feed into Interfaith's other shelter or anywhere else that they can find space. We opened with Interfaith again. It's now the Madison Family Shelter. You might remember it as the Faith Family Village. It was rebranded this year when it reopened in April. And that is 8 pallet units, 32 beds, specifically for families who are unsheltered. And I also want to point out that these shelters, Interfaith, the VOA project, working with Salvation Army, these are really intended to target unsheltered individuals and families in Everett. So while we know that the whole countywide, we have a homeless crisis, anywhere you look, we really want to be prioritizing the individuals in our community. So those are.
I'm just going to jump in and just say, yes, we need more. We need a clearer pipeline for all types of individuals experiencing homelessness. Some of them need extended services. Some of them need medical care. Some of them have dogs. Yes, right? And I think EGM is stepping up with their expansion, and they are really looking at all of those different nuances. And Ben will probably talk more about the cold weather shelter they're going to include in the women's part, and, like things like, or maybe in the future, they can come back and share more about their specific programs too.
Well, will you be mentioning anything, I think, about just day shelter? So not the overnight. I know that we had some ARPA dollars set aside for day shelter.
Yeah, the day shelter, in 2021, when we had the ARPA funds, $2 million was set aside for that. And we have worked quite diligently with multiple partners to try and see if we could create and develop a day center. No project ever really came to fruition. And so I also think we've learned more about what we would need as a day center. I think when we originally, the Streets Initiative created a day center idea that was like, come in and have coffee and hang out. And now we know much more about the population and their needs. And so we need a higher level of sophistication to meet the needs of the individuals. And we haven't accomplished that. And so there's really no other update regarding a daytime shelter at this point. And we have a mode and we have care team, right, that are helping people to get better connected to actual services rather than just a place to sit and have coffee. So we need it all. May I say that again, but I know you know this.
I have a question on the housing projects. I know in the past, we've had some issues with different management styles in these facilities. And so what is your role been when it comes to working with the organizations and their management style.
That's something I'm actually going to talk about. That's a really important thing for the success of programs. I'm going to talk about that under the safety focus.
Oh, okay,
So
great.
absolutely, I will
Thank you.
address that in just a moment. Before I do move from housing and shelter, cold weather shelter was mentioned. I think it's worth noting that we do a lot of work with the county and their contracted service provider for cold weather shelter in Everett. Last year, we increased capacity. We went from 49 emergency cold weather shelter beds to 84 cold weather shelter beds. And we're working right now with the county on really hopefully identifying a south location. That's been something that we've been working on for a couple of years now. And hopefully we can find a spot in South Everett.
And anyone can reach out to Ben Breeden at the city of Everett if they have a location, please.
Breeden at everettwa.gov. Thank you. I should also say that Everett Gospel Mission is in the middle of a big expansion, which will bring a permanent location with increased capacity specifically for climate-based emergency shelters. So that is another thing as part of that project that you see on the screen that they're specifically focusing part of their project on emergency shelter. So yes, I'll talk about safety now as the next focus, which includes your question, council member. And this really is an important element, making sure our rights of way, our parks, our neighborhoods, our public spaces, businesses, all are safe. In 2023, the City Council approved the buffer zone ordinance, which controls access to the right-of-ways within the designated zones. And this really ensures that around service locations, that people who are trying to get access to those are not impeded. And it also protects the areas that have been inordinately affected in our city. So I share a screen with you. This was data provided by the data analyst in the police department. And you could see this is 3 of the 4 buffer zones. The top orange line is around the Fred Meyer, I don't know if that's seafoam or teal or whatever color that is. The middle one is around the 2020 shelter at the UCC church. And the shorter one, which has been established a little bit more recently, is the cantaloupe salmon colored line. But you could see they're all descending. These 3 that we have enough data to quantify are demonstrating on average a 51% decrease of police callouts to these buffer zones. So I would contend on that element, we're seeing that these are being successful. They are addressing street level issues, safety issues and concerns in the buffer zones that we have established. I also want to point out regarding buffer zones that ordinance does sunset this year at the end of 2025. So it will be coming back to council for in the future, and it will have a staff recommendation for continuation. I work with the encampment removal policy, our public works encampment cleanup crew. They keep our right-of-ways and our parks clean and clear as much as possible. Since 2023, they've cleared nearly 700 camps, addressing that with safety. They work with our care team, with our police. I do a lot of work, as you were just asking about, coordinating education efforts with our service providers. So whether that's permanent supportive housing, the shelter providers that I identified, Interfaith and Everett Gospel Mission Volunteers of America, do a lot of work with them to mitigate neighborhood impact. We have what's called a management plan, which is a tool that helps articulate the elements of whatever service program. We use these outside of this as well, but specific to your question for safety at shelters. Identifying what the program is, things with security and safety on site, how are neighbors able to communicate, what is the lines of communication that the service provider is able to have, and then again, what is their plan to address the neighborhood impact mitigation? So we do a lot of work with that, and those are living documents that we have annual reviews with. working with Captain Fairchild and EPD. We just spent a lot of time working with Compass Health this last year. They did a lot of work on their management plan. They've updated their security. They've created lines of communication for the neighborhood. They've done a lot of work as a result of this education process that we've gone through with them.
A couple of questions.
Mhm.
With regards to Compass Health, we've been having a lot of public comment and folks coming in talking about other incidents and still a lot of frustration with the activity and the things that they're seeing. On your graph here, it doesn't look like the line has changed much when it comes to Andy's Place and police response to the buffer zone incidents. What are we supposed to do about this situation? It doesn't seem like the buffer zone is having an impact there and changing anything.
How many hours do you have? Because it's a really complicated project and we talk about it around Compass, but we're also next to the transit center. We have some homes that we're obviously been working on that are neglected. It's next to the jail. I mean, there are so many different factors. And maybe again, I think that we've had specific meetings just on that topic. But rather than taking time to dive into that, and Ben can certainly share a little bit more about the high level things that he's been in the trenches. I mean, they have worked so hard trying to mitigate these problems, but for today, it might not be able to give you
Maybe
enough.
just a couple thoughts on that. First, the Andy's Place does represent a 17% decrease in almost a year. So there's not a perfect solution, and no buffer zone, I would contend, is going to have the exact same result or response. So there has been a reduction in that. I think that you also see, Chief, maybe I don't think it's unfair to say that there's also been a lot of proactive policing there. This has been an emphasis patrol, which in the very nature is not reducing police presence. So we are seeing, and those police patrols, I can tell you from being at neighborhood advisory committee meetings with the Andy's Place staff and neighbors, has provided a big difference. Their parking patrol, I wish I had the numbers for it. They've done a remarkable parking. It seems like a unicorn that we're always chasing issues with parking, but the work that the parking enforcement team has done has really had a tangible change in that neighborhood. So yes, there is multiple things that neighborhood is being challenged with. And since I've been working with Compass Health staff, I want to be very clear whenever it comes up that not everything that happens in that neighborhood, as Julie was saying, the nuisance properties, the jail, they're kind of in a triangle of services in that part of our city. There's a lot of things happening, and I think we're trying to be consistent in taking regular swings. We're not going for a home run with anything. There's not a silver bullet, but I think there's persistence that we want to have in that area.
Thank you for the clarity on the multitude of issues that area in particular is facing, because we hear a lot from neighbors talking specifically about Compass Health.
Yeah.
But I think that's very important information to put out, that it's not all tied to Compass Health. There are so many other elements of that and so many other reasons of that just being hot spots in that general area. Because I know in times that I've met with Compass Health, the difference now of all the steps that they've taken and so many of the things that they've done, it's been a lot. So thank you for the clarity on that. You look like you had something to say, but I have other questions too.
Yeah, I just also want us to remember no, I don't. I'm going to wait on that one.
Great. Okay. With the buffer zone, is this timeline of July 23rd, that coincides, that's where it starts, but we had buffer zones created well before that, right?
The ordinance
Around
was passed in July 2023.
Didn't we have buffer zones created for other areas though that were?
No
There's
sit, no lie.
There's a no sit, no lie, which is
Yeah.
different.
Okay.
kind of around the Everett
For
Gospel
Gospel
Mission,
Mission.
which is a distinct, there's a similar element of the no sit, no lie in the buffer zone, but that's different than the ordinance specific for buffer zones.
In the ordinance, for clarity, this is the one that it wasn't establishing these buffer zones. It was allowing for the mayor to unilaterally create things without council's legislative approval. Is that the one?
It did establish the tool, and it has reporting mechanisms in it. We've reported to this committee a couple of times on them.
I wasn't asking in a challenging way. I was just trying
Well,
to,
we might call it a little challenge.
my recollection of which specific ordinance, because I didn't recall actually voting on like specific areas on the merits of them.
That's right. The ordinance established like the metrics that were needed for a zone to be assessed by staff, recommended to mayor, and then the mayor had the ability to implement the tool and report back.
Okay, thank you.
Which is quite a robust process to go through and identify qualifying events in a specific area. Even defining the geographic area in some parts of our city can be challenging. So we were talking about, did I answer the questions about buffer zones sufficiently? And talking about working with service providers. And again, the management plan is kind of the formal tool, the process that we go with. There's ongoing interactions with our service providers to make sure they're successful. One of those things that is ongoing is using CEPTED as a tool that we can offer for service providers and businesses, residents. CEPTED is crime prevention through environmental design. And so I am often invited to do site surveys. In fact, I just did one last week for the YWCA on Broadway, and I'm able to provide a handful of recommendations that I think are attainable for them to implement, that I think will also make a difference for their facility and for their staff. And so those are just a few of the ways that we are focusing on safety. The next focus is internal collaboration. I think as we're talking about this, it's probably evident to all of us that addressing the symptoms of homelessness really does require a multifaceted approach. If somebody calls 911 with an emergency pertaining to the symptoms of homelessness, whether that's something illegal activity, drug use, behavioral health crisis, the city has a great response for that. If somebody uses our Everett at Work app to report an encampment that they saw in a park or in the alleyway, we have tools to initiate that workflow and to address that. We have emails and calls, all these different ways that people come in, and that concerns and questions come in, and we have departments that have their focus and their strengths that requires internal collaboration really to have the robust response to the symptoms that I think that we do have. And I would say that we as community development get to function in a lot of ways as the conduit that allows our different departments, whether that's responding to the emails, phone calls, processing requests, sharing management plans, the different tools that we have working with police on CEPTED reports or trespass letters. Those are all things that we're doing as far as the internal collaboration that is always kind of an ebbing and flowing in the life of our city. And then the last one I'd like to talk about is engagement and outreach. It is not uncommon for me to get phone calls on kind of the other side of the table from well-intended individuals or a group who has a really great idea about a program they want to start in a park or in some of the low-hanging fruit that you could probably identify throughout our city. Other times I get to meet with great groups. Last week I met with, 2 weeks ago, I met with WSU, who's developing in their medical residency program some street medicine outreach. I get to meet with churches, faith communities that want to do things in our community. And there's an element of engagement and outreach that I think is very important in order to help these good intentions understand the guardrails, sometimes the policies, the best practices in order to develop a healthy program. I've been around long enough to know that good intentions only go so far, and you have to have good implementation so you're not dealing with negative side effects of those good intentions. So often somebody will call and I'll be able to ask the questions. I love that you want to bring food out Saturday evening. Do you know about our buffer zones? Can I help you? There's a permit, a free permit that I would love to help you get filled out so that you can understand our kind of have some mutual accountability. So we know what's happening. So you know our expectations. Have you thought about garbage after your program? What happens when 20 boxes of pizza are left on the sidewalk, right? Or talking to WSU, using them as an example. We've been doing roundtables with medical providers, doing street outreaches, really to help them understand the landscape so that we don't have 4 medical providers all duplicating services at one location at the cost of missing other places in our city that need those same services. I participate in neighborhood advisory committee meetings throughout the month, working with Interfaith, Andy's Place, VOA. Those are a few of those. And then we also, as community development, maintain proactive presence in our city. We have forums on a regular basis where we meet with our community partners, give updates. We hear from our community. We do events earlier this year. We hosted a free screening of No Place to Grow Old. We had some really great feedback from those events as well. So in just a few moments, those are the kind of 5 priorities, 5 focuses that we've been working on to address homelessness. I don't think that we've fixed everything. I really do hope we will work me out of a job at some point. But I think that we are seeing some really good progress. So thank you for letting me share this with you.
Questions? Yes, Councilman Bader.
Got a few here. So, and thanks, first of all, thanks for the expertise and wisdom that both of you and your teams bring to this. I mean, just extraordinary to, I mean, I know being on city council, every problem that seems like it's easy to fix, regardless whether it's here or utilities or, paving the street, is really much more complex, and certainly true here, and appreciate all the wisdom you guys bring to that. First question would be, could you talk a little bit about if an encampment gets reported, what's the process for dealing with that?
Couple elements about that. If an encampment is reported, there's probably the first triage with that is public or private property. So if it's on public property, we do have kind of a workflow to address that. If it's on private property, we obviously want to make sure that there's safety. So we make sure that if it's on private property and there's something illegal or unsafe, please call 911. But also we need you to understand that the city cannot and should not be doing things on private property. If it is on public property in parks, for example, or on our sidewalk, we have the 3 primary departments that are involved are our care team for providing outreach. Trying to get people connected to service is always an important element. And then Public Works and PD, and the 3 departments kind of work together on the order of operation, making sure the site is safe for cleanup. If it's an illegal camp, we have a standard 72-hour for cleanup. If it's in an immediate cleanup area, like a critical infrastructure or around a school, or impeding the right of way, then it is subject to an immediate cleanup. And so then there's a more expedited process for that.
Yeah. I think I've had calls, emails from people, and I'm not sure if they've ever actually reported the encampments, just kind of expect. And I don't know what if our police officers see, or even the social workers see an encampment, do they just take action on their own, or are we just, much like code enforcement, I think has been in the past, are we just driven by constituent
Right.
complaints, for lack of a better term?
Mhm.
So.
Can I also just say that I'll put a plug in for that Public Works encampment response crew. We don't see the massive large scale encampments that are massive health hazards, safety hazards like other communities do. They are pretty prompt in keeping the right of ways cleared. I remember maybe at the beginning of this year, There was a Friday afternoon fire drill because it was a couch and a tarp.
Yeah.
And that was that's the, so I'm not minimizing the realities or some of the encampments, but just all that to say that between our police and our public works and our cares team in addressing encampments, we have, those departments have done a really good job on having a solid cleanup and a method of addressing and bringing resources to those individuals.
But and I guess bottom line, if we were to tell our constituents, if you report an encampment, our city will deal with it. And there's a process for getting those people to a better
We do,
place. And
yes.
getting the encampment.
Everett at Works is the way that we're really trying to direct Everett residents to report.
Right.
That is not an emergency response tool. So if there is something illegal, please don't put something in there for that. Call 911 if you see something unsafe or illegal. But we do have a process that goes through for addressing it using that tool.
Ben, I don't know if you can speak to it, but encampments have a definition, right? And it means that people have items that they're sleeping with and kind of moving in, you know, so it's not just an individual that's sitting on a park
Understood,
bench or sitting
right.
on a sidewalk or something like that. So I don't want it to sound like, hey, anybody that looks like they're homeless or have an encampment, that we're going in and cleaning that out. So just
Correct.
a little nuance of,
Yeah.
thank you.
Our policy, our encampment removal policy does articulate that it needs to have evidence of habitation.
Yeah. Okay.
Yeah, and that's a really good point.
Yeah, understood. No, great point to make. Second question would be, looking at that great chart you put together of the police response to buffer zones. I mean, great work on that. But kind of following on Councilmember Fosse's comment that, we're still looking at 10 calls a day, in that buffer zone area, right? And I know there's no magic, as you guys pointed out, to take care of, but, I guess one thing would be, what typically in the city in a similar geographic area, how many police response calls, or what, maybe it's not even just police, but beyond that, are we getting in a similar geographic area? How much higher is this than a typical area? I guess, might be, and I'm not sure I'm not saying you have the answer now.
We
but that might be
didn't,
a good
I don't
piece of
think that
data.
there's a 2 square block control that we could say this is a baseline from which we
Okay.
could measure everything. But I would also say to the other side of that it would not be hard to create a lot of buffer zones based on the way that there are qualifying events. So I think we're really trying to be strategic in this. And to use this as a tool that doesn't just tax our emergency response, but to focus on service locations or highly impacted areas that term that I said that they are, what I don't even remember what word I said, overwhelmingly, or they have a higher than average interaction with police response because of the issues in their right of way.
Understood. I think for at least around Andy's place, part of the challenge was it felt to the neighbors like Andy's place, et cetera, was not really being as cooperative as they thought the institution. And I know you work with various groups and institutions to, get a plan together and do that. But I think, and I don't know if that's unique to that group or if we're finding that in the other buffer zones, or we're having trouble getting what residents think would be adequate cooperation from a service entity. Yeah.
Right. Well, I generally leave a Yelp review when I've had a problem. So it's not surprising that you're hearing a lot of the challenges and the dissatisfaction, but those same people I think would also say they're seeing a lot of difference. There's always going to be issues and concerns, and being a loud wheel has gotten a lot of traction in that area.
Mm-hmm. Yeah.
So
I also throw out, remember, permanent supportive housing is relatively new. Post-traumatic stress from the days of doing that work, but and at the same time, when we created permanent supportive housing, we didn't have the understanding of what the landlord tenant laws were going to require. And so that also changed the landscape. And we also have a coordinated entry system that dictates who goes into permanent supportive housing. And then therefore, the agencies weren't necessarily prepared as robustly perhaps that they needed to be to deal with the clients that they were serving. So the model, again, in just 10 short years has been a bit of a rocky road. And, Andy's Place continues to learn as well. So they are also opening their phase 2 in just a couple weeks, which will add additional services for people who are in mental health crisis. It will provide places for people to stay overnight when they're having a mental health crisis. And so hopefully that also will benefit our community so that people who really need a place to stabilize have a place to go.
And if I could, one final question or issue. So your comment, what is really valuable for me to hear, do you take calls from churches and community organizations, et cetera, that want to help out? And this relates to this last point is, when it's organizations or churches from outside Everett wanting to come into Everett rather than provide help or assistance in their own communities. And then segueing on that a little bit to, you talked about how many beds are in Snohomish County. And I think for many of us, the whole issue has been Everett is taking way more than our share of the population of at least the overall county population in Everett. And it feels like the lack of cooperation from Marysville or participation, Marysville, Mill Creek, Mukilteo, Lake Stevens, Snohomish, that they don't really do their fair share. So, any thoughts you can share on the shelter beds that are outside of Everett and when you get solicitations or offers of help from organizations or faith communities outside of Everett to come into Everett to help? So, I'm really grateful for.
Was the question what?
What are the proportion of shelter beds in Everett versus the county?
Yeah.
And related to that, is there any effort on the part of the rest of the county to do something?
Well, I can speak specifically to what's happening in Everett.
Understood.
I think it is important to note that of the individuals identified in the point in time count, probably close to 50% of those are in Everett. And it's using the point in time data, it's hard to quantify that specifically, but I think that is a safe thing to say anecdotally and with what we understand is happening. One way that I would articulate it with some numeric backing up, the bed count, the average bed count for cold weather shelters countywide was 110 beds. 55 of those were in Everett. So, I mean, that's just one way to look at it. The Everett Gospel Mission is one of the primary shelters in the county for men's sheltering. So, and I can understand that. It's the county seat. A lot of the resources are here. I know that the mayor's been working, and I can't speak with anything specific about that work, but I know that that has been a priority in helping our neighboring municipalities understand and have some responsibility. I know that we've had that within our team in working with Providence in understanding the importance of having a better system that closes the loop when a municipality brings somebody from any city that's not Everett to Providence. Just walking through the door of the emergency room is not the end of your responsibility. So, and that's a really easy thing for anyone to take advantage of that. So it's a really big ship to turn. I know that we've had that happening at Everett Gospel Mission where people have been dropped off and we've made calls to please come and have a better onboarding plan for the individual that you're bringing from your city. So I can't speak to, I wish I could. I meet with, I host a monthly meeting with people in my role throughout the state. And I know that they're facing a lot of challenges similar to what we have. And I feel very fortunate for what we have established, what our departments are able to do, and what the shelter programs and the services that have been established in Everett.
Appreciate that. I just think, and you guys probably experience this too. It isn't hard to go on social media and find people dumping on Everett. And I think our reputation is certainly affected when we're doing way more than our fair share of, helping people in Everett. And I think Everett's really stepped up. So anyhow, thanks.
I have just a couple other things. I really appreciate all this information. So we had an issue with Claire's Place
Mm.
when there was a lot of drug use inside and we had to evacuate and all that. So what are we doing now to help mitigate that from happening again in one of these, in a shelter?
Claire's Place is permanent supportive housing,
Mhm.
which is distinct from shelter. It's an important element. If I were to define a spectrum of housing needs for individuals in the 0 to 50 AMI range, but it's distinct. And so there are tenant landlord laws that govern that. I think the biggest thing, so let me answer your question this way. We are working with those service providers. Andy's Place is a great example of working through a process to identify areas where they can improve with security, with their programs, with the things that they're doing outside of their property.
I'll just throw out, the city is not responsible for Claire's Place. Catholic Community Services and Catholic Community Housing is responsible for Claire's Place. And so, that's just obviously, there's always things that cities can and cannot do. And we can't force them to do things. There's also state laws that they have to follow. And I think that we learned more than anything during that time that the fentanyl was a new drug that they hadn't, the health department hadn't figured that out yet. And thankfully, we haven't gone back and revisited that. So
Mhm.
I appreciate you bringing it up because we should, to know if things have changed within the state level so that if it does happen again, we understand the new
Mhm.
climate. Second to that, understanding opioid use disorder and fentanyl differently and using the peer model approach and the street medicine and meeting people where they're at. So being able to deploy the emote team to places like Andy's Place or Claire's Place so that they can start building relationships with those individuals who may be using and to partner with the service providers at those permanent supportive housing units is kind of our strategy to try and mitigate or prevent that from happening again.
Okay, great. And then one last question I have, we have 3 projects in development and we've heard about these for a couple of years, some of them. Do we have a timeline on any of that or approximation?
Volunteers of America are anticipating a grand opening later this fall. In fact, I was emailing with Nalia to find out which date they're choosing for that.
Mhm.
Pallets were installed yesterday, today, should
Oh,
finish up
great.
tomorrow.
Great.
That's very exciting. Everett Gospel Mission, I'll do New Start next. New Start has said that they will be ready to take clients by the end of this year. We're working with the Salvation Army on their management plan. There was a few facilities issues that it sounds like delayed their
Mhm.
timeline.
Right.
Um,
So can you tell me anything about that type of housing? Is it shelter housing? Where does it
it's
fit?
72 units of what they're calling emergency bridge housing.
Okay. It would be nice, when they have that kind of laid out to get an update on, and so we can fully understand what type.
Yes.
Yeah, great. And then
Gospel Mission is just in the beginning stages. They're working and they have a timeline to getting their permitting
Mhm.
submitted. They're very optimistic in, attainably optimistic, possibly, occupancy for cold weather shelter by December 2026.
Oh, great. Yeah. Well, we've had presentations from them and it's always fun and
Correct,
interesting.
yeah.
Okay, I don't have any more questions. Councilmember Fosse might.
My questions might be transitional into the next agenda item. So I am curious, and this may be a conversation that we would need to have a presentation for another day. But is there anything we're anticipating federal impacts wise that we're looking at that we may have to take into consideration in doing our budget or take into consideration on things that we may have to find more local resources to support? And that is something that I know that's a big question. If there's a thematic one-liner, I'm okay with that. If that's something you want to tackle at a future agenda item, that's okay.
I think it's fair to say that a lot of the federal funding filters down and through the county. And I would think that it would be important to assume that there's a lot of uncertainty in future investment in those in those programs in the future budget years.
For today, we know that we were granted a no-cost extension for our SAMHSA grant. It was due to end on September 30th. And so that is a fantastic bit of information. So we'll be able to continue on with no changes. We do know that the county was able to secure the continuum of care funds so that we didn't have a huge $15 to $17 million cliff that we would have had to fix. Again, to Jennifer's point, we don't know what will happen with the next round of funding. So for today, we're all hanging on. Our food programs are suffering. The early FEMA cuts directly affected food programs, food banks, meal programs, VOA. So a lot of our agencies also that have direct federal funding programs that may not be even affiliated through the city of Everett have had to make layoffs and cuts. And so we are seeing that. We are also seeing additional concerns of information gathering about certain populations that then could eliminate funding for housing vouchers or for ability to work. And so those are also things that could impact our community pretty drastically.
Thank you. With how much progress that you're making and how much I've even heard it from neighbors about, the crime level going down and people the issues being addressed with people who are unhoused and making strides in the right direction. It would be such a shame if all of that gets stalled because of some federal impacts. So I appreciate the insight on that. My other question, I think, is related to a future proposed agenda item. SEPTED. I would love to have just an update on all the places that we look into environmental design for mitigation and what's out there and all that kind of stuff at a future. And I don't know if you're a person to contribute to that or who would be great, but I remember this was involved in some of the conversations. We were looking at the Everett Housing Authority and the concept of the design there, like had they taken into consideration environmental design when trying to mitigate, any potential future issues. And so it crosses so many areas of how that can be a really positive kind of often secondary approach, but it makes a big difference. And I would love some sort of update on whatever conceptually that you guys would want to bring forward.
Yeah, that's great. And I'll just give you a nugget, maybe foreshadowing. So I mentioned some of the work that I do, which is really kind of a microcosm on a very small level, right? And very straightforward. Better lighting, better visibility, reduces the unwanted activity. We also had SEPTED elements as part of the Vision Zero, some of the larger scale things. SEPTED was present in activating Casino Road with the power boxes. There's one of our planners went through SEPTED training actually, which I think is wonderful. And I'd love to continue to develop collaboration with him, with James, in ways that we can utilize that, whether that's landscaping and a better understanding of our codes, fencing, things like that, as well as some of the larger scale planning. So there are elements of SEPTED that we're really activating as many ways as possible.
I think a presentation, involving a lot of those things, plus also things that we can recommend to our neighbors that they take in consideration on their own properties for safety considerations to be included in that presentation. Because there's so many safety elements, whether it's your own personal residential or we're building and developing something out there or we're making improvements. All of that I think is kind of helpful information.
Is that like a educational workshop or a policy development?
Just a future agenda item if you guys want to talk about
I'm
it.
asking because we like to, when I talk with staff about capacity and how to provide good information to you guys, we often like to focus on policy development versus like fun to know, useful information, educational, which has a lot of value, but maybe
But-
this isn't the right setting for it. So just
So
understanding the
knowing those different elements in our public safety committee that we have here and creating safe communities, I think it's important for us to know all of the ways that homeowners and people with their own properties can contribute to the solutions. And so I do think that there's a little bit of education there also in how we make our policies and how much the ability is, the onus can be put on the homeowners to help mitigate some of those things, but also, and that's just a small part of what I was talking about with the education about all the environmental design stuff. But when we're doing other things like the work that we did with the Everett Housing Authority and that design, like that information came in very helpful in the work done there. So it's helpful for us to understand it in us doing our work.
He also kind of inspired me because what if like we have a PowerPoint presentation that he could do, but maybe we could do a little video where he could do a presentation and then it could be on our website, be available for everybody or something. So it's a way to better educate our community. And I'm sure Ben would love to be behind the camera. So we'll
No, I want to
maybe.
be in front of the
Oh,
camera.
yeah, that's true. Sorry. So we'll like kind of, let's
I
do
will,
on
I
that.
will just tag just briefly because of the work that EPD and community development did with Andy's place. Part of what we did was some of the SEPTED principles. Lighting is being updated on that street. The trees are all very overgrown on that street. Now, those are the property owner's responsibility. So unfortunately, I can't come in with my chainsaw and fix the problem for you. I'd love to. However, as part of that work, Parks is now exploring how to make a citywide resource of tree maintenance. And so I know that they have staff that they're trying to be as efficient with their time as possible, but that is in the works of a SEPTED tool that could be available citywide.
All right, any other questions? Well, thank you so much. Very informative. Appreciate your work. So, and that's all we have for tonight. Thank you.
So I wanted to say, I'm not related to what Ben and presented about, but one that I wanted to throw out there, and I don't know that it'd be, I think I connect with Jennifer on this. I don't know, it'd be the city lining it up, but would it be worth, since we're community health, and also would it be worth ever asking the health department or health district to come present on like the efforts they make to increase vaccination rates and that kind of thing? So just throwing that out there is something. And I know, if we'd have to have Angie ask them to come or what, but just throwing that out there as a possible
Okay,
topic.
put that on the list and
Yeah,
chat with Jennifer on that.
thanks.
All right, thank you so much. We're adjourned.